Alright guys, so this is going to be my mobilization video. So my patient is lacking 20 degrees of plantar flexion and I need to do a mobilization to increase that plantar flexion. So first, for patient position, I'm going to have my patient lying supine on our table, and for this we want to make sure that their knee is bent a little bit so they can have their gastroc completely relaxed and shut off, allowing the most movement throughout the ankle. So I place our roller right here to give me that knee flexion. The ankle we want to be in the neutral resting position, so that'll be neutral in between inversion and eversion, and about 10 degrees of plantar flexion. And then me, I will be down off towards the end of the table, off the edge, working on the ankle. And obviously, since we are on a bed here and not on a treatment table, my body mechanics might not be as great as they could be. So with our ankle joint, the concave convex surfaces, we have our tibia and talus forming the concave part of our joint, or tibia and fibula, sorry, is the concave part of our joint, and then the talus is going to be our convex part of the joint. And in plantar flexion, we have our convex on concave moving in opposite directions, so we have a roll posterior and a slide anterior. So to increase plantar flexion, we are going to be doing an anterior mobilization. So we're going to take our top hand, we're going to be gripping right at the top end of that joint, right on that tib fib. Bottom hand, I'm going to place down here at the calcaneus, because that's going to help me give my best anterior mobilization movement. And when we do a mobilization, we're going to give them about a grade 1 distraction force, so that'll be perpendicular to our treatment plane, so it'll be this direction. And then my mobilization is going to be parallel to the treatment plane, so it'll be going in this direction. So right here, go ahead and give him that grade 1 distraction, and then we're going to give him an anterior mobilization. And then in my scenario, since we didn't have a specific injury and we don't know if he's pain or stiffness dominated with his range of motion, we don't know exactly what grade mobilization we would do, but we'll just kind of run through those real quick. A grade 1 mobilization would be fast mobilizations at the very beginning of the joint range of motion. Our grade 2 would be slower mobilizations throughout about the middle of the range of motion. Grade 3 would be, again, slower mobilizations, but that'll be up to the end range of motion of the joint. And our grade 4 will be fast mobilizations at the end range of motion. Alright, this is going to be my stretch portion here. So we are going to be doing a hold, relax, stretch technique of the supinators. So for this test, we'll have our patient laying supine on our table. This way we can have his entire humerus be completely supported by the table. So with our one hand, we'll be supporting up here at the elbow. That's just going to be our support hand trying to stabilize the arm. Our other hand will be down here at the wrist, and this is going to be our hand that's going to be doing the stretching, doing the movement. So we'll be stabilizing here, motion with this hand. And since we're stretching the supinators, we want to put them in their maximally lengthened position, which is going to be pronation. So for the hold relax technique, this is going to be utilizing the inverse stretch reflex. So we are going to take our patient, we are going to passively move him into maximal pronation until we reach his end range, till we feel that tissue resistance. And then once we get to there, we're going to instruct our patient to supinate against our resistance. So while he's supinating, we are going to be holding him, not allowing him to move, creating an isometric contraction of the supinators. We're going to hold that contraction for 5 to 10 seconds, and then instruct the patient to relax, and then we will further pronate him, further lengthening the supinators into their new range of motion. We'll hold that stretch for several seconds, and then we will allow our patient to relax. We can let them relax for about 5 to 10 seconds, and then we'll be repeating that process 3 to 5 times to complete the stretch.